Knock knock. My name is Ronnie. Today I'll be inserting a G-tube. I'm going to wash my hands and I'm going to identify the name of patient. Can I have you state your name and date of birth? My name is SpongeBob. Date of birth 6/19/80. Thank you so much, Miss SpongeBob. Today I'll be inserting a G-tube. Therefore, at this moment, I'm going to lay out all the necessary equipment on the table. I'll raise the bed to my height and also raise Miss SpongeBob's head to the angle of 45 degrees. I'll put a towel over Miss SpongeBob's chest just in case anything falls. Then therefore at this point I'll put a new set of gloves. Then I'm going to inspect Miss SpongeBob's nostrils. And I'm going to ask her to exhale. And then through the other nostril too, while I hold this one. And it's for the matter of getting the nostril that has the greatest airflow. Okay. So I'm going to measure Miss SpongeBob's distance. I'm going to measure the distance right from the nose to the ear and then all the way down to the stomach. And so this is going to be the distance I'm going to have to insert so that it can go all the way into the stomach. So at this point, I'll get the G-tube, place it in warm water as I proceed with other, with a setup. So it can be warm, so it can be warming. After measuring the distance that I'm going to apply the G-tube, I'm going to get the G-tube, place it in a lubricant. Make sure it's a little bit lubricated. And then I'm going to ask Miss SpongeBob, I'm going to place it in the nose until I feel some sort of a resistance. If I feel like a resistance or Miss SpongeBob feels uncomfort or feels like throwing up, I'll ask Miss SpongeBob to tilt the head all the way. And it's at this point that I'm going to ask Miss SpongeBob to drink a little bit, try to swallow as I insert the G-tube. Okay, drink a little bit as I insert it down. Okay, down. So once the G-tube reaches down the stomach and I feel like it's in the stomach, I'll encourage Miss SpongeBob to drink, which is going to be about like 5 to 10 centimeters. After making sure that it's all in, I'm going to put a tape by the nose. Knock knock. My name is Ronnie. Today I'll be taking out the G-tube. Can I have you state your name and date of birth? My name is SpongeBob. Date of birth 6/19/1980. Thank you so much. I'm going to double check and verify it. Yes, thank you. That's right. I'm going to provide privacy, putting the curtains. Then I'm going to disconnect the G-tube from the suction unit. And I'll disconnect the suction unit, the G-tube from the suction unit. Then I'll ask Miss SpongeBob to take a deep breath for me as I take it out. Okay. Using a towel, like that. Thank you. I'll wrap the G-tube in a disposable unit. Then I'll measure and record the drainage in the suction container. I'll ask Miss SpongeBob to clear the nose, try to cough and make sure everything's fine and is breathing well. I'll measure the output. Lower Miss SpongeBob's head down, and lower the bed down. I'll wash my hands, and that's it. Thank you.